Hello, everyone, and welcome again to our Kaya Wellness and Longevity podcast. Today, we have a very special topic that we're going to talk about, and it's plastic surgery. And we have our very special guest today, our head of plastic surgery at Kaya Wellness, Aesthetics and Longevity, Dr. Vikesh Bij. Dr. Vikesh is a revolutionary plastic surgeon with years of experience and blending art together with science to bring the most natural results to you. Welcome, Dr. Vikesh, to our podcast.
Thank you so much, Samina. It's an honor to be here, and I'm looking forward for this conversation today.
Great. So, the first thing is we want to ask, how did you get into plastic surgery?
Okay, so I come from a family of physicians. My
Mm.
dad and I was growing up. I tend to gravitate towards medicine. I used to attend hospitals with them, sometimes go visit the wards as well. So I always knew that medicine was my calling. So that is how I went into medicine. And when I was doing my undergrad, during the rotation, I realized surgery was something which really fascinated me. I like the operating room, and I like the overall ambience in a surgical field. So that is what made me take general surgery.
Okay.
And during my general surgery training, we are rotated amongst all the specialities of the surgery.
Mhm.
So in that particular rotation, I realized my liking towards more towards plastic surgery. So I could see more of the instant gratifications that we could
Mhm.
give to the client. So
Mhm.
that is how I that was my journey from undergraduate to a general surgery resident to a
Okay.
plastic surgeon.
Great. That's very interesting. So, tell us what is different in today's plastic surgery versus what was, say, 10 years ago?
So I would say, as compared to 10 years before, now we have better technologies.
Mhm.
So when it comes to body contouring, as you say,
Yeah.
we have better machines, and
Mhm.
we have somehow mastered the art of causing, better skin contraction.
Mhm.
So the results that what we could give 10 years back, we can give much refined results nowadays,
Mhm.
and the downtime and the patient results satisfaction is more as compared to what it was 10 years back.
Okay. So there's a lot of myth around plastic surgery. Is it something that's very invasive? Is it an extreme makeover? Tell us a little bit about the more, let's say, effective but less invasive treatments in plastic surgery.
Okay, so uh, that's a very good question. So plastic surgery in general is a big, field.
Yeah.
So it has various specialities like reconstructive
Yeah.
plastic surgery. It has congenital or the cleft lips. It has
Mhm.
hand surgery. It has microsurgery,
Mhm.
the lymphatic surgery, the burn surgery, and aesthetic surgery. So talking about aesthetic surgery, right from small minimal invasive procedures to, yes, extreme makeovers that we see. So when we talk about small procedures, we have smaller procedures which can be done under local anesthesia.
Mhm.
That could be either a double chin liposuction
Yeah.
or a tightening of the skin.
Mhm.
So those are less invasive procedures.
Mhm.
But compared to them, there are procedures which are more like a liposuction or a body contouring
Mhm.
surgery. So they would be called as more invasive procedures,
Yeah.
but would have more dramatic results.
Okay, that's great. So we see a lot of, let's say, celebrities looking very fake, and people are concerned about looking natural. So how do you ensure that people look natural in their surgeries?
So with the ongoing social media trends,
Mhm.
people tend to gravitate more towards, going or following a certain trend,
Mhm.
which might look good on certain individuals or certain celebrities, but might not look good on you.
Mhm.
So what we need to understand, we need to respect the patient's ethnicity,
Mhm.
their needs.
Yeah.
What might look good on somebody might not look good on you.
Yeah.
So patient education is more important. And
Mhm.
also we need to understand these results are somewhat permanent.
Mhm.
So most of the times you can't really go back on them. So
Yeah. 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 So
which is in trend right now might not be in trend maybe 10 years later down the line.
exactly. So I think there's a recent trend of cat eyes.
Yeah.
So tell me a little bit about this.
So cat eye is more of a brow lift. When we talk about a facelift,
Mhm.
uh, a traditional facelift involves incision all around from the temple to all the way till the neck. So it
Okay.
addresses the upper face, the middle face, and the neck.
Okay.
So cat's eye or fox eye procedures are more targeting the upper part of the forehead.
Okay.
So
Okay.
they are just, you could say, more redefining or more of a brow lift.
Right.
So they are
Okay.
it has been now recently renamed.
Hmm.
And yes, there are more extreme versions in which a patient sometimes opt for more exaggerated looks,
Okay.
which might look good on some individuals but
Hmm.
might not look good on all.
That's for sure. That's for sure. So another myth is, are you too young or too old for plastic surgery? So tell us a bit. Who are your youngest patients? Who are your oldest
Okay,
patients?
so that's a very good question. So I'll talk about hair transplants.
Hmm.
Okay, so there is no certain age, I would say, if you're too young or too old.
Yeah.
It is more if you need the procedure and if that is going to have a positive impact on you. So
Hmm.
I've done a transplant for as young as 19-year-old,
Wow. Okay.
so who was having grade 7 balding, very
Right.
advanced stage of balding,
Okay.
right from his teenage.
Hmm.
And I've done a hair transplant for as old as 65 years old.
Wow. Okay.
So I would not say there is you are
Hmm.
too young or
Hmm.
too old for a procedure. It is what
Okay.
makes you feel good,
Hmm.
more confident, and if you're a candidate for a transplant or for any plastic surgery for that matter.
Okay. Okay. That's great. So tell us the three most requested surgeries that come to you.
I would say liposuction,
Hmm.
breast augmentation,
Okay.
and a tummy tuck. So breast augmentation and tummy tuck also are together known as mommy makeover, most
Okay.
commonly opted for.
Right. Are there any underrated procedures that you think people maybe don't have enough knowledge or are something that are very minimally invasive that can be done for anyone?
Yes, I would say eyelid surgeries,
Okay.
especially blepharoplasty,
Yeah.
is something which is a bit underrated.
Okay.
It can give you a more refreshed look.
Hmm.
It can take care of the excess hooding which you see above the
Yeah.
eyes. So I would say blepharoplasty is one such procedure.
Okay. Okay. Now let's just go back to hair transplant. It just reminded me of something when you spoke about blepharoplasty. Is eyebrow transformation. So people come in for eyebrow transplants. Tell us a little bit about this.
Yes. So when we talk about eyebrow transplant or any transplant for that matter, what we're trying to do is we're trying to redistribute the hair from back of the scalp
Okay.
to an area where you don't have that much density.
Right.
So if in certain individuals who
Mhm.
do not have thicker eyebrows,
Okay.
okay, or maybe due to some scar,
Hmm.
they have lost some particular patch or have a patch where
Yeah.
they don't have
Hmm.
eyebrows. So that can be transplanted. So we
Okay.
use hair from the back of the head or the nape
Hmm.
of the neck
Hmm.
and then transplant them. So uh, that way we can cover up the scar and they
Okay.
can have fuller eyebrows. We can also do a beard transplant for that matter.
Okay. That's
Somebody who
interesting.
does not
Yeah.
have a thicker or a fuller beard
Yeah.
would want to do, provided you are a good candidate,
Right.
we can offer them beard transplant as well.
Okay. That sounds amazing. So there are also some recent trends of mini facelifts and tweakments. So just tell us a little bit about what does this entail?
So nowadays, people are wanting more of minimally invasive procedures.
Hmm.
They want, in this fast-paced world, they would want something which gives them instant results.
Yeah.
They would want the benefit of a surgery,
Yeah.
but do not want the downtime or the recovery which comes with a normal surgery.
Yeah.
So these small procedures, like a mini facelift,
Hmm.
is something which addresses only the mid face.
Okay.
So as compared to a traditional
Hmm.
facelift scar, the scar is bit smaller. So
Okay.
we just place an incision just here and it can address this limited area.
Okay.
So if you're a good candidate for that, so
Okay.
that is a procedure which people would say like a mini facelift.
Okay.
But provided you do not have skin laxity in other parts of the
Okay.
face.
Mhm.
So if somebody has like an overall laxity of the
Right.
face, a full facelift is something that would give them a better result rather than just addressing the mid face.
Okay. Okay. That sounds great. Now, there's also a lot of trend around health tourism. So, do you have any patients that come in, fly in from all over the world, and come to Dubai specifically to have treatments
Yes,
done?
so that is a very good question. Yes, Dubai is a hub for
Hmm.
travel and health
Yeah.
tourism. I get a lot of patients
Hmm.
who do not have the best of health services back in their home. So I have
Okay.
patients fly all the way from Africa,
Wow. Okay.
and because they do not have that certain amount of healthcare in back because they don't have that healthcare
Yeah.
back home,
Hmm.
so patients do come to us.
Okay.
What we can do is we can always sometimes what I do is I do an online consultation with them
Okay.
beforehand
Hmm.
so they get an idea what is to be expected.
Right.
Their and my goals are aligned,
Yeah.
and when they come in we can
Hmm.
fasten the blood test and everything so we can have them have their operation fast, and
Okay.
then the recovery and everything, and then they can fly back the same time, and I'm always available on
Hmm.
online consultations with them.
Right.
So I always guide them. What they do is I also get in touch with the provider what they have back home, so
Yeah.
just in case if there is something that a medical professional would understand, I can always get in touch with them.
Okay, that sounds amazing. So now there's a very recent trend on body contouring. So liposuction was what we imagine maybe somebody very overweight.
Mhm.
Tell us a little bit about the body contouring of liposuction and treatments like that. How's that trend?
Okay, so see, body contouring, when we say, there are two types. I can broadly classify body contouring in two parts. One
Okay.
is the non surgical, and
Okay.
one is surgical.
Right.
When I talk about non surgical,
Hmm.
it includes mostly the energy based devices that we
Right.
have. So it can be either cool sculpting or
Okay.
cryo.
Yeah.
That is, all these procedures are basically lipolysis. So
Right.
they would dissolve the fat, but
Okay.
they don't extract the fat at the
Mhm.
same time. So these are
Okay.
basically lipolysis. Lipo
Right.
means fat and lysis is to break down.
Right. Okay.
So cryolipolysis or cool
Okay.
sculpting,
Okay.
then when we freeze the fat.
Hmm.
Then we have injection lipolysis when we use certain injections to just dissolve the fat. We
Right.
also have some energy devices which would heat, or some laser or maybe some radio frequency
Yeah.
devices.
Okay.
So all these are classified into the lipolysis category of body
Right.
contouring.
Okay.
But we also have something known as surgical body contouring.
Okay.
So that would address one, the excess fat
Hmm.
and the skin. So it
Right.
could be liposuction, it
Hmm.
could be a tummy tuck, it
Hmm.
could be either a body lift, it could
Hmm.
be maybe an arm lift or a
Hmm.
thigh lift,
Hmm.
it could be a breast lift.
Hmm.
Also, when we talk about body contouring, even a facelift and a neck lift to a
Hmm.
certain extent are also part of body contouring.
Yeah.
And with the ongoing trend of people using more of weight loss injections,
Hmm.
so they
Yeah.
tend to have more of skin laxity.
Yeah.
Also, in the past, we had patients when they had more of massive weight loss,
Yeah.
so they had loose saggy skin.
Yeah.
So they no matter what they did, they had excess skin.
Yeah.
So we needed something to address that skin
Hmm.
laxity. So for that, we needed to address that by body contouring. So
Hmm.
all these come under a broad classification of body contouring services.
Okay. Great. So, of course, there's lots of trends, and people want to follow trends out there.
Yeah.
How do you make sure that you balance the trend with what's right for the patient? How do you solve this?
Okay, I would say patient education is most important
Hmm.
key in this.
Yeah.
uh, Sometimes what the patient actually needs
Hmm.
is different than what the patient wants.
Right. Yes.
So there, the role of a good physician comes in play, and
Yeah.
he is the one who should always educate the clients,
Yeah.
because what they see on social media
Yeah.
is, I would not say always fake, but
Hmm.
most of the time it's edited.
Yeah.
There are filters on that. So
Yeah.
you need to educate the patient what is good,
Yeah.
what is not good,
Hmm.
what is something that is going to last with them
Yeah.
forever.
Yeah.
So I think patient education is the key in this.
That's fine. So you mentioned forever. Tell me, do you have any clients that come back to you again once they've had a plastic surgery for something else or a repeat of a procedure?
So I would say, if we've addressed some particular area,
Mm.
like if somebody had like skin laxity, or
Yeah.
it was a big procedure, somebody had lost weight massively,
Yeah.
and then sometimes what we do is, in order to ensure patient safety,
Yeah.
we stage the procedure. So we
Okay.
can do it in two parts. Like somebody needs address, if we need to address the arms, the
Okay.
breast, the
Hmm.
tummy, and
Hmm.
the thighs. So maybe
Right.
we'll stage it in two
Okay.
sessions.
Hmm.
So then, yes, the patient would come for a second session later on.
Okay.
Or sometimes, if somebody does not want a full tummy tuck,
Hmm.
okay,
Yeah.
but is overweight,
Yeah.
if that makes sense. So
Mhm.
what we do is something known as slim down liposuction. So
Okay.
if they have provided they have a good skin
Yeah.
laxity, so we do a liposuction, and we wait for the skin to retract.
Okay.
So if in that case we see the skin has retracted well,
Hmm.
patient is happy, then it's fine. But if later on patient would want, that they're still not happy and they would
Hmm.
want a tummy tuck, and then we can always offer them. So yes, those patients would come.
Okay.
When we talk about facelifts,
Hmm.
generally these surgical procedure would last say 10-15 years.
Okay. Wow.
But yes, after any procedure,
Yeah.
if somebody does not maintain a good lifestyle, suppose they did a body contouring surgery, and
Yeah.
after that they are not very, I would say, religious with their diet. They're
Yes.
not eating well. They are going on the wrong track.
Yeah.
So all the work that was done on a surgery
Yeah.
is gone. So yes, they might be coming for another procedure later on. Then.
Okay. So tell me a little bit about recovery times. If I want to have a plastic surgery and I want to have a liposuction, how long does the procedure take and how long will I take to recover?
Okay. So that is actually one question that I get asked
Hmm.
a lot of times,
Yeah.
because people just get scared about plastic
Yeah.
surgery.
Yeah.
So again, liposuction, if it's for a smaller area,
Hmm.
say if it is just for the double chin area,
Yeah.
so it takes about maybe half an hour.
Okay. And is that under local
Yes,
anesthetic?
exactly.
Okay.
So this can
Okay.
be done under local
Okay.
anesthesia.
Right.
Uh, so there are some liposuction of certain areas, like if it could be for gynecomastia and
Yeah.
males. So in
Mhm.
that case, also we need to do the liposuction to
Okay.
sculpt the chest,
Right.
and also there is a component of gland which needs to be removed.
Okay.
So
Okay.
in that procedure, also it takes
Yeah.
about 1.5 hour.
Okay.
When we talk about liposuction of the tummy or
Hmm.
the flanks,
Yeah.
it takes about 1.5 hour.
Okay.
But if it is like a 360 liposuction
Yeah.
with anterior uh,
Hmm.
abdomen,
Yeah.
flanks, and the posterior back,
Yeah.
it might take about 2.5 hours,
Okay.
depending on the amount of fat that has to be removed.
Right.
So the patients after the procedure would
Hmm.
be needing to wear a pressure garment,
Hmm. Okay.
okay, which is one very important
Hmm.
thing that they should always keep in mind.
Okay.
When we talk about the downtime
Yeah.
or the recovery,
Hmm.
I would say for a liposuction of a double chin,
Yeah.
I would say about 2 3 days.
Okay. Okay.
They need to wear a pressure garment.
Right.
Okay.
Okay.
When we talk about the tummy, I would say patients can resume work in 2 to 3 days,
All
provided
right.
they wear a pressure garment.
Okay. Okay.
Uh, Return to normal activities in about 10 days,
Okay.
and return to like exercise,
Yeah.
I would say about 3 to 4 weeks. It depends on patient and
Okay.
depends on the areas which are
Recovery
treated.
and things
So
like
it has to be customized in that sense,
that. Okay.
which they can get an idea when they come for a consult. So I
Okay.
would
So let's go through some myth busting quick fire questions. Is plastic surgery only for women?
know, nowadays more and more men are coming and opting for plastic surgeries.
Okay. Is liposuction a weight loss treatment?
No, that is a myth. Liposuction is more of a body contouring or a sculpting procedure rather than a weight loss procedure.
Okay. Can you get the same results from fillers as you can from surgery?
Uh, Fillers are generally temporary when we
Hmm.
talk about hyaluronic acid.
Yeah.
So temporary results with fillers as
Hmm.
compared to surgery are going to give you permanent results.
Okay. And plastic surgery leaves big scars.
Not necessary now.
Hmm.
The scars nowadays are placed in very hidden spots, and nowadays we can do the same procedure with minimally or minimal incisions. So
Okay.
even the scars that are placed are
Hmm.
in well discreet or hidden areas. So that is again, I would say, a myth.
Okay. Great. So let's talk a little bit about the emotional and psychological impact of plastic surgery. Um, how do you find your patients when it comes to the emotional, let's say, wellness pre and post surgery?
Yes, so that is one very important question
Hmm.
and very important aspect. So when a client comes to me, when I have a consultation with them,
Hmm.
uh, there are some certain times when you could help a client in a certain way, because sometimes they don't feel confident in themselves
Yeah.
just because of certain insecurity.
Hmm. Yeah.
So if you could address that,
Yeah.
it gives them a lot of confidence
Hmm.
and gives them the boost that they need in life. So I would say emotional component related to plastic surgery is a big aspect to when we talk about plastic surgery.
Okay. So following on from that, have you seen anything that's very memorable or a patient very memorable that you found has a very, let's say, life transforming experience with you?
Okay, yes. So I'll give you one example. There was one client of mine.
Hmm.
He was about to get married. He was
Okay.
working in this part of the world,
Okay.
and he was always wearing a hair system because he was having a bald patch.
Okay.
Okay,
Okay.
and he was doing video calls with his fiance, and it on the video calls the fiance did not know that he had
Okay.
balding.
Okay.
So just before the wedding,
Yeah.
he came for a consultation, and I did a proper consultation with him
Okay.
and advised that he should go for a hair
Hmm.
transplant. And then we did a transplant, and
Okay.
everything went very well.
Hmm.
And he was very happy with the results. When he
Okay.
went back,
Yeah.
the wife did not know, like, whether it was from the
Yeah.
transplant or with the
Okay.
system.
Yeah.
He even invited me to his
Wow.
wedding, which I
Okay.
could not
Okay.
go.
Okay.
But yes, that was very
That was
sweet
nice.
of him, and
Yeah.
he's still in touch with me.
Okay, okay. I think the life transformation is very different to aesthetic. It can really change your outlook in
Absolutely,
life.
absolutely, yes, it can.
Definitely, that's fine. So let's talk a little bit about choosing the right surgeon and the right clinic. What do you think patients should look out for when looking for a surgeon?
Yes, so that is a very good question, because in Dubai there are
Mhm.
so many clinics, there are
Yes.
so many places that people
Yeah.
can opt for.
Hmm.
What I would say most importantly is to look for the credentials of the surgeon.
Hmm. Yeah.
Okay, always trust a brand
Yes.
which you have faith in.
Hmm.
Do your research well.
Yeah.
Don't fall for cheap, pricing,
Yes.
because quality comes at a certain price.
Correct. Yeah. 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 And what do you think is the biggest mistake people make when they're choosing the surgeon?
I would say people tend to somehow prioritize pricing
Okay.
more on quality,
Hmm.
and they end up getting procedures that they don't like.
Hmm.
And then when we need to revise a certain procedure,
Yeah.
it is one more difficult
Yeah.
because it's already been, I would say, botched,
Hmm.
or and also it comes at a more higher price because it's a revision
Yeah.
procedure which needs to be done. So I would say patients are more inclined, or patient tend to think more about a monetary benefit,
Hmm.
that they would maybe save money right
Yeah.
now,
Yeah.
but they don't understand the long term
Long term thing.
consequence.
So, what's your final advice for any client who wants to get plastic surgery?
So I would say patients who want to opt for plastic
Hmm.
surgery, they should do it for themselves.
Yeah.
Don't look for the society. Don't do it for anybody
Yeah.
else. Whensoever you feel you're ready,
Hmm.
you should do the procedure and do it for yourself.
Definitely. Okay, so how can people book for a consultation at Kaya Wellness Anesthetics? So tell us.
Okay. So I would say we have a very good social media page,
Okay.
and we do post information on that.
Hmm.
Our helpline numbers are provided on that, so there is a call to action button,
Yeah.
and you can always connect to the call center.
So, Dr. Vikesh, tell us, why should people choose Kaya for their plastic surgery journey?
So Kaya has been in the Middle East for more than 20 years
Yeah.
now, and Kaya is known for its the brand, the quality, and the patient care. And now Kaya Wellness has added plastic surgery department
Hmm.
to its armamentarium, and we'll be offering the same standard of patient care
Yeah. Hmm.
to the clients.
Yeah.
And we'll be off, and also Kaya is known for offering the latest technologies, be it
Yeah.
any machines, be it the latest technology and the best product for the clients.
Yeah.
And the same is being that and the same is going to be done for plastic surgery as well. We'll be offering all the latest devices, we'll be offering all the latest treatments.
Great.
So I think that is the most important reason why people should choose Kaya for their plastic surgery.
So, Dr. Vikesh, thank you very much for being with us today. I've learned a lot about you. I knew a lot about you, but I didn't realize a few things. So, it's
Yeah.
very interesting. And thank you for joining us today at Kaya Wellness and Longevity Podcast. Plastic surgery is a new department within Kaya. And feel free to contact us for a consultation, and we will be happy to provide all the information that you need to take you and your journey of plastic surgery within Kaya to its safest and most rewarding level. See you next time.